Hi everyone, how are you today? Welcome to our third episode of our web series, Cut It Out COVID, on behalf of ImmuneKicks and myself as a practicing medical oncologist. And our mission here is to tell the real deal of what's going on with the coronavirus situation out there in not only our nation, but also for the world, and speak from a very data-driven way, speak from medical studies, speak from the hard facts, and really communicate to you guys in the general public that we have a much better handle of the medical situation than what you would be led to believe by some of the bluster that's out there in the public sphere. And therefore, I feel like it's part of my responsibility as a physician, seeing patients, concerned about our neighbors, our society, our citizens, etc., and to communicate that we are on a very good path. The situation is much more in control than what you would be led to believe out there, and explain exactly why from the data, not just us giving that supposition, but also explaining why that exactly is, like we've talked about in our past couple episodes, and like we'll continue to do for the sake of our knowledge, which is really crucial for all of us to be intimately aware of what's going on. And not that everybody has to know every last detail. Some people might want to distance themselves intentionally because of concerns, but this is exactly why we want to communicate these aspects of the reality of what's going on. That to say that things are not raging out of control, things are not lost. We are very much on a good path in terms of understanding the nuances of who is at risk, who is at exceedingly low risk, and what kind of path we are, for the next several months. And therefore, because of that, it's really crucial for us, I really feel, to balance the needs of society in a much better way than what's been done so far, at least within the United States, for many parts of the country, to understand not only the medical side, which is obviously critically important, and we are highly concerned about making sure that gets under control as soon as possible, stabilize as soon as possible, so we get back to normal or there as close as possible, in a reasonable time frame. But at the same time, understanding the other needs that are out there, like our jobs, our kids' education, our work-life balance, our mental health, and all these other factors that are critical for the functioning of society. After all, these are things that affect all of our lives. This is not simply medical data or studies or clinical trial. This is stuff that's affecting all of our lives, and that goes even deeper than something like a particular infection or anything else of that nature. And to recap briefly about our last episode number 2 of Cut It Out COVID that we did, we talked about two major issues. One is that the pitfalls of PCR testing. That PCR testing detects in a very sensitive way the genetic code that's left over after past exposure to coronavirus. And therefore, that genetic code may be present for weeks, if not months later, as has been shown in medical studies, like we talked about in episode number 2. So please check it out if you'd like to learn and hear about all the nitty-gritty details. And therefore, just because somebody has a positive PCR test for coronavirus, it does not imply infectivity. So therefore, one is not necessarily infectious just because you are PCR positive. It has to do with other critical factors like symptomatology. Are you symptomatic, not symptomatic, etc.? And that really changes our likelihood of whether somebody may truly be infectious, or is it simply a positive test from past exposure. And that's why these numbers tend to be inflated by that rationale, that not everybody tests positive because many are asymptomatic or minimally symptomatic. Because of that lack of symptoms, relatively speaking, many of these people are simply not infectious any longer. They may have had coronavirus or have been exposed to coronavirus, weeks or even months ago, but they may continue to have detectable genetic code because of the sensitivity of the PCR assay. Number 2, we talked about last episode, was in-hospital mortality. That the in-hospital mortality, so even out of that minority of patients who do wind up having a severe case that wind up going to the hospital, those patients are doing much better in terms of their survival rates once they get hospitalized with coronavirus. And that has jumped from being in the mid-60s back in spring of last year to now in the upper 80s, close to 90%, currently. And this is reflecting a lot of our understanding of the medical nuances, understanding of the medical management, having hospital protocols, having infection triage that's much better. So we are able to triage patients, put them in the right wards, etc., to prevent spread of infection around the hospital or in other patients who are admitted as well. And also PPE availability in addition. So all these factors have led to a much better medical handle of what's going on in the in-hospital setting for those hospitalized patients, and therefore why they're doing so much better than they were before. And so that's just a quick recap of those two major points that we talked about last time. major issues we're going to talk about this episode are going to be the media and why too many media outlets are broadcasting news in a very irresponsible and a non-data driven way, number one, and also what are the pitfalls of that type of tack taken by these media outlets, that not every single one naturally, but many of them unfortunately that approach it in this manner in terms of like a scare tactic, clickbait type of headline driven strategy that a lot of these media outlets use, and why that's quite irresponsible and also has downstream consequences to our mental health, anxiety, depression, etc. So we're going to focus on mental health as well as a second aspect of our video this afternoon. So to dive right into the media, the stuff that's out there and what's being promoted is really this kind of yellow journalism, clickbait type of mentality that's being promoted. Because after all, the way I think about it is that good news does not make good news, so if things are under control, that doesn't translate into a good story, right? I mean, the media or any news outlet, whether it's a TV station, a website, etc., is not going to generate a lot of views by saying, hey, everything's under control, we're doing okay. That kind of stuff doesn't drive clicks and drive views and everything else. And after all, let's face it, this is a very money-driven type of angle. Not surprisingly, this is nothing new. But for example, a couple years ago, CNN, as a major outlet out there, generated over $600 million in advertising revenue, on an annual basis. So when you talk about that type of money that's at stake, naturally these sites are motivated, implicitly to get people to look at their website, click on their articles, and read their news. So therefore, the game has become how many clicks, how many views can you get, because that drives web advertising. So because of that dynamic, it's very important to be cognizant of this dynamic, because that's what's driving this kind of amazingly high revenue, right? We talk about more than $500 million of revenue from one source, much less many other sources, cumulatively that are out there. So obviously this, does have a significant factor when you talk about that much money at stake. And at the same time, the type of sources that are out there are very poor sources when you talk about that kind of, journalistic integrity, that research into the background before you promote something and publish something as an article, compared to yesteryear when not that things were perfect, but there was much more at stake in terms of having the journalistic integrity to vet data, vet articles, and before you put it out to the public, really research it well, know your sources, and explain it well. Now instead you get stuff like, coming from Facebook and these other kind of like things that are just pop-ups on your smartphone, that sort of stuff, things that, there's scant references, it's not a balanced viewpoint, nothing of that nature at all, because after all, if you come up with a headline to say, hey, terrible things are happening, it doesn't matter if it's vetted or not vetted or researched or not researched or out of context or whatever it may be, that ultimately will drive that kind of news, because that scare tactic kind of stuff will drive views and clicks, etc., unfortunately all too often. But the downstream consequences are that people read these things. Our society, our neighbors, our friends, everybody else, our relatives, they're reading these things, and that's affecting people's lives, their minds, their anxiety, their depression, everything else. And that's where really I feel like it crosses a line to irresponsibility, because it really is something that it's an important outlet, and being cognizant of your own power as a media source, cognizant of your own power about what you may be sowing in terms of this type of fear, anxiety, etc., that is affecting people's lives, especially when they're looking at this as their source of news. And so unless people like us, like physicians who are, intimately familiar with the data, speak up, people aren't going to hear that kind of news unless you have a good friend who's, is a scientist, researcher in the medical field, or, somebody, who is speaking up, like myself and others. Unless you hear from these kind of sources, you're going to hear from the news, and the news is simply going to tell these kind of very biased viewpoints, and that's just, unfortunately the way it is. As I remember my history teachers in high school and college always explaining about being cognizant about media bias, knowing your source, and that that some degree of bias will be implicit within virtually any media outlet. I mean, to have a pure objective type of news anchor source is almost impossible. I mean, that's really the reality. There's some that have less bias, that's true, but overall there's always some bias that's built into these various sources that are out there. And I'll give you a couple headlines that I saw just recently. I mean, you can, see these every day, literally, unfortunately, And so just to give you a couple that I looked up just to kind of have to quote for today. So a couple from January 15th, for example, that were promoted on Facebook, for example. So one of them was an article that was being circulated that had this kind of clickbait type of link that said, and I'm reading it, verbatim, scientists just issued this horrifying COVID warning. That scientists in general are, issuing a horrifying warning. We're not going to say what it is. You have to click on the article. Because why? Because you click on the article, and that's what drives that kind of ad revenue, for example. If you just look at the article and not click on it, the article headline and not click on it, they don't generate advertising revenue, for example. Number two, warning, in quotes, warning signs you have COVID now, according to the Mayo Clinic. So, that's, obviously not even remotely reassuring. Let's put up random symptoms and then say, oh, well, these are signs that you might have COVID, Because, I mean, as a respiratory pathogen like coronavirus is, SARS-CoV-2 is that you're going to have a lot of these kind of relatively non-specific constitutional kind of symptoms like fevers and sweats and fatigue and so forth. So because of that, it's not specific for COVID necessarily. I mean, there are some that have been, come into the public sphere much more readily, which are accurate, like the lack of the sense of taste and smell and so forth. So there are these kind of things that are more commonly known that could be more of a tip-off potentially. But again, a lot of the symptoms are pretty vague. Another one is after the recent vaccine drive that's been coming out, which is a very good thing because we're going to reach population immunity much faster, and that's going to be a significant step in the path to getting us back to normalcy. So one headline said, doctor in Michigan on why he's delaying getting the vaccine. I mean, that to me is just irresponsible, especially on part of a physician to promote that is really irresponsible, especially, kind of buying into that kind of fear tactic headline to be complicit in that type of avenue. Second, and the last one I'll quote right now is, in quotes, nurse gets COVID 3 days after her first vaccine shot. First of all, you don't generate adaptive immunity, that antibody generation, within 3 days after a vaccine anyway. Secondly, the two vaccines that have been authorized in the U.S. for administration are both an initial dose and a booster dose. So you have to get both of them anyway, to get that adequate antibody generation and that adequate antibody specificity to target and protect you from SARS-CoV-2, from coronavirus. So this kind of headline, nurse gets COVID 3 days after her first vaccine shot. I'm sorry to hear that nurse, contracted coronavirus, but to imply that the vaccine failed because she got it 3 days later, I mean, that's not even remotely in consistency with immunology or science in general. And as a quick aside, we're not going to go into censorship in detail right now, but it is a really valid concern what's going on right now. Censorship on a lot of these kind of public sites like Facebook, like Instagram, like LinkedIn, and people who are trying to speak up and not and being censored because of perhaps some things that they might be saying that are somehow flagged in a relatively arbitrary fashion because they may not be going with the common non-data driven mainstream media type of approach to this kind of messaging. And I mean, I also believe that there should be certain ground rules to these things. I mean, you can't just say anything that might perhaps be laced with profanity or stoking immediate violence, and there are certain things that are clearly out of bounds, so to speak. But at the same time, I'm personally a believer philosophically that censorship should still be rare. Outside of those clear no-nos, it should be rare. I mean, if something is debated in the public's debate and in the crucible of public debate, then that's good. I mean, I want to debate with people. I want to hear from people. I want to talk to colleagues and other associates. and then have that nice discourse back and forth, and then within the crucible of that debate come to the truth, right? I mean, that's what you want to have come out. Because if people are really saying crazy stuff, I mean, it's going to be recognized out there, and kind of what has been recognized to some degree. There are a lot of people out there who clearly realize, taking a step back and say, oh, look at this. The media is clearly stoking this kind of fear and anxiety with these kind of headlines like I just read off. And those headlines were taken from January 15th, by the way, as far as the date, January 15th, 2021. As far as the date. So, the way I think about it is that let's go into some first principles about what are some of the issues that are why my supposition is that the media has this kind of irresponsibility. The biggest being that they are the megaphone about what is being said out there. Because again, the media will take what is maybe the real information. They might even not even get to the real information. They might just hear one angle or one person, and that questionable source gets put into like an article, and so they are like a megaphone for whatever bias or angle they want to have. They are not speaking as the New England Journal of Medicine or, Clinical Infectious Disease or any kind of reputable journal. Instead, it's just like this megaphone that's out there. Secondly, we talked about how the coronavirus situation is affecting the nation as a whole, as society across the board. Education, schools, many schools where people are learning, kids are learning virtually, which is, not adequate, compared to in-person direct teacher teaching, obviously, number one. Secondly, jobs are being affected. Many people have had their businesses suffer or even shut down. You talk about things like lockdowns or shutdowns, which effectively just shut down businesses, for a lot of people, unfortunately, especially those that are in those really cash crunch kind of businesses like restaurants tend to be, for example. And so number three is things like mental health being affected. Number four, work-life balance being affected, and all these things that really are impacting society overall. So it's not just the medical side. As a physician, I'm very, very cognizant about these other factors because my patients are coming in and telling me about these concerns, how their jobs are being affected. My patient just a couple days ago talked about how his daughter got laid off and now has to come back and live at home, for example. Patient with cancer, who now has to take on one additional responsibility because their daughter unfortunately got laid off, from work, So these are the kind of things that really are affecting people day to day. Other people that complain about how they can't sleep well because of anxiety, their depression has flared up, etc. Thirdly is that while all this is going on, the doctors, nurses, researchers, other frontline, healthcare people are working around the clock, 24/7, for months on end to try to get to the bottom of this and stabilize this as best as possible. And like I've mentioned, and like we've talked about in our previous videos, and will continue to do so in subsequent videos, is that the situation is much more in control than what you would be led to believe in the public sphere. And while there is still clearly a problem at hand, especially the prevalence of the virus across the board, way too common, we have to tame it and get the numbers down successfully in terms of that prevalence to give those people who are at risk that confidence and medical safety to get on with their lives and get back to normalcy as soon as possible. But we're working on that, right? So in that sense, in terms of the societal impact, while there's this frontline effort by certain specific professions, it's almost analogous to how war can affect society. And it's not to say, I don't loosely throw around the analogy of war, and I'm not saying it's war per se. What I'm saying is that the impact in society in terms of this very intrusive kind of impact across the board. So you may not have coronavirus at all. You might be part of the 98% of people right now who don't have coronavirus today in the United States, but you'll still be impacted because of the downstream effects of what's going on the front to fight coronavirus, So in terms of jobs and education and so forth, like we've been talking about. So, in that sense, when society is being impacted to that degree, that's where I think there is a responsibility to the media to say, let's be more balanced, let's be more reassuring, while of course being truthful. We want to be truthful naturally. We, in a free society like we have, we want to be communicating the reality of what's going on. And that's, for example, what I'm endeavoring to do, by this video series, as well. So therefore, we have to be cognizant of the morale of our society, of our population. So it'd be kind of like, imagine in something like World War II or some other armed conflict. Imagine if the headlines, instead of saying, hey, we're working on it, we're fighting hard, our soldiers, our troops are doing great, and let's be part of the war effort and help our soldiers get rations and phone calls and everything else to kind of keep up the morale of the country. Imagine instead of all that, it was just headlines that said, soldier dies within 2 hours of seeing the enemy combatants or something of that nature. Upon seeing the tanks of the enemy, a whole infantry retreated. Some crazy kind of inaccurate story like that. Imagine if that kind of stuff was being promoted in a setting of war. And that would be grossly irresponsible and not being cognizant of the morale of the citizenry that needs to be there for in these kind of efforts. We can't pretend like people are not affected by this kind of news when they clearly are. And there's data that they are, and we're going to talk about that momentarily as well. Furthermore, this is not the viewpoint of rational physicians, of rational scientists, of people, in terms of this kind of scare tactic type of approach. No, we want to tell people the truth. We want to tell people the real deal, but at the same time be reassuring that we got this. We have this under control. We're working on this. We'll get there, and we're on the right path, like we've been talking about extensively in the past few videos, and we'll continue to do so. So what we're going to talk about here is a couple things. We're going to talk about how this rationale of my supposition that the media has a certain responsibility to support the morale of people as we are battling the coronavirus situation to get the prevalence under control, continue the effort that's been going on out there, and not giving this kind of false type of news and yellow journalism type of news that would sow lack of public confidence or detracting from public confidence in the efforts of medical personnel and research personnel that are out there. So this kind of idea that to detract from confidence in the vaccine, the 2 vaccines that have been authorized in the United States, is one type of irresponsible tact that's being taken by the media, because we have to inspire confidence. We have to say that, look, these 2 trials that were done to get FDA authorization one was a 44,000 patient study, which is a phase 3 randomized trial. The second was a 30,000 patient study. So in aggregate, 74,000 patients were enrolled on this phase 3 randomized trial with excellent science behind it, excellent risk-benefit analysis behind it, and that's what led to the approval and why we can have faith that in addition to the other efforts that are out there on the medical front, the vaccine front will get us to population immunity, and that will be our real ticket to getting back to normalcy. So to talk about 3 key points as we get to the second half of this is the effect on anxiety, on depression rates, and domestic violence. So let's lead off with the first one. Domestic violence is one of those things that I really feel is a red line, essentially. When you talk about domestic violence going up, that's where I think you really, people, this has crossed the line. Domestic violence is a tragic thing that's within society, unfortunately, not just in the U.S., but anywhere, of course. But when we see evidence that domestic violence rates are going up, that's where I think, oh, wait a minute. This is really crossing the line in terms of unacceptability. And it's really one of those things that, when you say what are some of the downstream effects of this kind of fear that's being stoked and anxiety being stoked and people being forced to stay home and losing their jobs and now resulting in this kind of situation where people are stuck at home with perhaps a violent individual and resulting in domestic violence. That is strikingly, egregiously bad. There's not much more you can say beyond that. That is really, it's just totally unacceptable. So on that note, I'm going to share 2 quick articles over here. One is in New England Journal of Medicine talking about essentially a pandemic within a pandemic, meaning domestic violence rates ticking up in a very concerning way. And the second is from the American Journal of Emergency Medicine. Both of these were published in December of 2020. And let me show you the headlines real quick. And one chart I'll show you also to illustrate something. And here is the first one. This is for New England Journal of Medicine, published in December of 2020. And as you can see, quite a sad, headline and scary headline: a pandemic within a pandemic, intimate partner violence during COVID-19. And they go into detail in an article to talk about how this is, really a significant tragedy, that people are at home and therefore resulting in a situation where they're stuck with potentially a violent individual and are not able to adequately have an avenue outside of the home, the concerning home environment, that's resulting in domestic violence as a terrible consequence. Second one is going to be this next article, and here it is. And this is published in the American Journal of Emergency Medicine, and the headline and the article title is "Alarming Trends in U.S. Domestic Violence During the COVID-19 Pandemic." And I'll show you one table over here, which is this one over here, where they show in the percent increase in domestic violence in 2020, since the COVID-19 situation has begun in the United States after, it came to the country. So in Alabama, Oregon, Texas, New York City, 4 major areas they examined in this particular publication. So you can see over here, New York City, 10% increase year over year, 2020 versus 2019. San Antonio, Texas, up about 18% or so. Portland, Oregon, over 20%, and Jefferson, Alabama, over 25%. So obviously, very tragic that this is some of the consequence, where you have domestic violence going up by this amount. I mean, talk about really an unacceptable situation when you have that as one of the key consequences. And that's why I think that is why there are downstream consequences to this kind of irresponsibility. And as a result, look at what's happening. Domestic violence rates going up not by 1%, 5%, or something like that. You're talking about 10 to 25+%. And these are in 4 areas examined. There's no reason to believe that there aren't, unfortunately and tragically, many more areas that are also potentially affected as well. So that's number one. Secondly, let's look at depression and anxiety rates that have also gone up significantly, and this is from the CDC. And anecdotally, I would say that even talking to some of my good friends who are, from medical school, psychiatrists, for example, and other colleagues in my medical community, and asking them to say, hey, what's going on in your practices? Are you seeing more patients? For what diagnoses? And they tell me that anecdotally that they have seen a significant uptick in anxiety, depression, stress, all these kind of things. And I'm not shocked at all. I mean, my patients come into my office as a medical oncologist, and they tell me that they're stressed and anxious, and I'm not surprised at all that in a psychiatrist's office, naturally, they're going to see that exquisitely so, because that is, after all, their area, and they're going to see those kind of patients. And so as far as the depression and anxiety rates, and this was published it reported on the CDC website in Morbidity and Mortality, the weekly review series that are published every week. And so anxiety, as I'm reading the data, is up 25.5% rates of anxiety versus 8.1% year over year increase to 25.5%, 2020 versus 8.1% in an analysis comparing 2020 to 2019. Secondly, depression up 24.3% rate of depression among people studied and screened versus 6.5% year over year. And that was published by the CDC, National Center for Health Statistics. And this was based on the data that was analyzed this year based on what's happening to people during the coronavirus pandemic. And also, as a consequence, the downstream consequence of depression, one of the tragic ones can be suicide, right? So suicidal ideations are also elevated, and approximately twice as many respondents reported serious consideration of suicide in the previous 30 days in the time analyzed versus adults in prior years, referring to the prior 12 months. So the specific percentages was a 10.7% rate of patients with these kind of depressive symptoms resulting in suicidal ideation, so thoughts of actually committing suicide, versus a 4.3% rate in last year and previously. So, anxiety up significantly, 25.5% versus 8.1%, depression up 24% versus 6%, and suicidal thoughts up as well. And so this is, again, these kind of terrible downstream consequences, and to show why mental health is one of the pillars of what is affected by the coronavirus situation. So it's education, it's jobs, it's economy, and it's mental health. And that also dovetails into things like work-life balance, et cetera, things that allow us to keep that balance. Go on a nice vacation. Doesn't have to be fancy. Just go on a nice vacation, enjoy yourselves, relax a little bit, get away from work, get away from reality, so to speak. And you can't do that when you're stuck in a situation where you can't travel easily and everything else, based on draconian rules that are instituted in various places, for example. So therefore, in conclusion, I really believe that we can be optimistic. We really are on a good track, and already millions have been vaccinated, and that is really, again, a key component of us getting us back to normalcy, because ultimately, because the prevalence is such a major problem, the prevalence of the virus across the country, across the world, we really have to get that population immunity to get the numbers down successfully, protect the people who are at risk, which is, again, the minority of people, but that's still a critical point, to get the prevalence down, let people go back to normalcy, let kids go back to school, all these kind of things that really need to happen, ASAP. Even things like kids going back to school, I think is reasonable now, in my opinion, and what others have said also, including, from prominent societies as well. But, these are the kind of things that need to happen as soon as possible, and the vaccine is a key part of that. And just to give you one quick statistic is that as of January 15th, 2021, 6 a.m. on the CDC website, you can go to the CDC website to look at the up-to-date numbers on how many people have been vaccinated thus far. So 12.3 million doses have been administered as of January 15, 2021, which is really fantastic. Remember, this is only people in a restricted group that have been vaccinated until just very recently, as of this recording, on January 17, 2021. And so before, it was only doctors, nurses, other specific frontline workers, nursing home residents, etc. So because of that restricted group of people that were receiving the vaccine, naturally, a lot of the broader population has yet to receive it, and it's going to be in a tiered fashion, which is very medically appropriate. And so 12.3 million people thus far is an excellent number, really, when you consider that it is mainly only phase 1A that got the vaccine thus far. So therefore, just one more reason that the understanding of who is at risk and who is at very low risk. The fact that a very minor percentage of the population actually has coronavirus right now. The fact that the PCR test overestimates the infectiousness, because many people don't have infectious coronavirus, but they may have a PCR positive test because there's remnants of the viral DNA still detectable. So, these are the kind of things that say that, look, the situation is not as bad as what, has been promoted out there in the public sphere. There is clearly a problem, in terms of we are working on it, around the clock to get it under control, but it's not nearly as bad as what you would be led to believe in the public sphere because of some of the media outlets, like we've talked about in this video, that is really, some of this irresponsibility in terms of the scare tactic headlines and clickbait and everything else that drives, their ad revenue, but does nothing to reassure the public, and it has these very terrible consequences like domestic violence rates going up, stress going up, anxiety going up, depression going up, suicidal thoughts going up, and all these kind of things are really terrible consequences, and why I really feel, in my opinion, they really cross the line in that regard when mental health is ignored to this degree in such a, rash kind of way, when it's such a crucial part of society and our well-being as people, well beyond something like an infection risk that may be out there for, some part of society. So as we conclude, our next video is going to be on vaccines. What's the data, who should receive them, why it's a big deal. So hopefully you'll really find that informative and helpful as we roll out and try to achieve that population immunity we really need to get us on track and get us to where we need to be. And we'll talk about that. It's not that every single person necessarily has to get a vaccine, but why it's important that certain groups do get population immunity as soon as possible, high exposure, high risk, etc., and what are the pros and cons of everybody else considering it. But again, population immunity will be part of the big key for how this goes. So if you have enjoyed this so far, please hit the like button. Please hit the subscribe button down there on the YouTube video, and hopefully you'll continue watching and listening in our web series, Cut It Out COVID, and hopefully you'll find it informative that as we continue to tell the real deal of what's going on out there, concern for you as the general public, for my neighbors, my friends, my family, my patients, everybody else, that we really need to know what's going out there. At the same time, reassure to say we are on the right path. The medical people, the scientists, the researchers, we really are working on it and getting us on the right path, and we are on track. It's not nearly as bad as what what you would be led to believe out there. And I think that's a crucial point of understanding that'll hopefully help to mitigate some of these very terrible downstream effects, like the mental health effects we've talked about in this video. Lastly, accurate knowledge is power. So, continue to listen to our video series and listen to the real deal. And we'll keep moving beyond the noise that's out there. And see you next episode. Hang in there, and we'll do our best to keep on, telling you the real story of what's out there in a very data-driven way. And have a great rest of the day, rest of the week, and we will see you very soon in our next episode. And thanks again.